Welcome to Healthy Heart. This is Dr. Isaac Opoku Asare together with my producer, Mr. Blay. And thank you for tuning in. We appreciate you listening to us. And I believe that we have a number of very exciting programs ahead of us. I believe that this series that we're going to do is going to go a long way to help you, because we would like to focus on certain very important aspects of cardiovascular health, and hopefully we can also bring along other doctors to talk about other things. But with respect to the heart, I believe that what we're going to talk about will go a very long way to help you and make you better. So once again, I am an interventional cardiologist and a vascular doctor. Specifically, one thing that I do is when there are blockages in the blood vessels, we open them up. And that is something that we're going to talk about. We want to talk about arteriosclerosis. That is a big terminology. But if somebody asks you, what are we going to talk about today? We're going to talk about plaque build-up. Plaque build-up in the blood vessels. And this is something that occurs in virtually every blood vessels in your body, specifically the arteries. So we have you have three blood vessels in our body, which is the arteries. The arteries are the ones that take blood from the heart to the body. The veins, they are the ones that take blood from the rest of the body to the heart. So the veins contains less oxygenated blood, and the arteries contain the oxygenated blood. And then we have the lymphatics, which takes away the fluid out of our body tissues to ensure that at the end of the day, there wouldn't be swelling of any part of the body. But before we, let me, I was going to jump, but let me come back. Why am I talking about this? I'm talking about this because we've been doing very complex cases of people with heart attacks and people with blockages in their legs and specifically the arteries or the veins. But I can tell you that I have seen cases recently that I've not seen before, and that is why I believe that we need to have a separate discussion about why do people have a plaque buildup? Because this is a question I get all the time from my patients who end up asking me that question. Doc, why did I have a heart attack? And I believe that by the end of this particular discussion, we may not finish today. We may come back and continue probably next week. But I hope that will explain that your first bite of probably unhealthy food or your genetic predisposition was when the process started. And the fact that you are walking around, I've seen people, as I said, I've never seen before. And I'm going to give you these things for you to know that it is critical and important that you invite your family members to join us for this particular series, because it's going to make a difference for you because of the stories that I want to share with you, which I believe that is going to go a long way to be able to help you. So before I go to that, we're going to go for a short break and come back. And then we will start the topic on plaque. How do plaque build up in our bodies? And how do they relate to heart attacks and other things? So I want to start with this discussion. We have COVID-19 that came upon this world, evil, a great evil that we've never seen probably in our lives. And I'm trusting God that we'll never see again because of the devastation it has caused nations and people all over the world. And the good thing is that at least in most places that I know of and in most hospitals, at least within the areas where we work, the numbers continue to go down. But the good news is the fact that we have a vaccine on the horizon. I just had a discussion with a lady, and this lady is an African American woman, a black woman, and her concern was the fact that she's been heard that they are not getting enough black people for the vaccine, and for that reason she may not take it. Let me just be clear here. I understand the concerns that people have, but it is important for us to be able to understand the demographic composition of this country and understand how studies have been done all over and make a decision here. Let me put it this way. The African American population is the population that probably has been affected most by COVID-19. I read somewhere that probably this year, 2020, COVID-19 may be the second or the third. I don't know those figures clearly, but it may be the second or third cause of death among African Americans. So black people in this country, it is critical and important for you and me to be able to make sure that anything that is available for us to help us from succumbing to the COVID-19, we need to make sure we take advantage of. And I'm bringing this issue because when certain people live in certain parts of the country, their idea of the composition of blacks in this country may sometimes not reflect what is there. To make it clear, as at today, at least based on U.S. census, the United States census, as at 2019 and 2020, there are about 320 million people in this country. Blacks make up only 13.4%. I want to repeat. Blacks make up 13.4% of this country. And I asked this particular lady, how many percentage of blacks do you think is in this country? Her estimate was 40%. Once again, I want to quote the number. The number is only 13.4%. We recently did a hospital-based national database, and the person was presenting. And the population of blacks within that particular trial was around 13%. And that lady said that, okay, it looks like African Americans were not represented well in the study. And another person raised their hand and said, the population is 13%. You have 13% in this particular trial. So where lies the basis for talking about that? So it is important for you to understand that in most trials that have been done in this country, proportional representation of African Americans have not been appropriate. Have not been adequate. But it must be looked at from the perspective that our composition of the population is 13%. And most studies, the number of African Americans, if it is truly representative of this country, it is going to be around that number. So that if a particular study is going on, and at the end of the day, they're able to only 15% of the population is African Americans, that is a true representation. I do not know the numbers that they are talking about. But if they are talking about numbers like 12% or 13%, then I will tell you that that number is very much representative of what? Of the composition of African Americans in this country. And therefore, that should not be a reason for you to deny yourself, right? Most of the medicines that you and me take in this country, most of the cardiovascular medicines that has been found to be helpful, whether you're a black person, a white person, or any other race in which you are, almost all these medications, the trials that were done, had very little African American or black representation in them. Yet at the end of the day, they tend to work very, very well. So the reason why I'm saying that is this: we have seen very heart-wrenching stories And this particular COVID-19 has caused a devastation in many Black or African American homes. And therefore, if there is a vaccine that has been proved by the people that are expected to be in charge of it, either CDC or FDA, and is being certified to be appropriate, I will strongly encourage you to have a discussion with your primary care doctor or have a discussion with your doctor about the medication and avail yourself to it, especially if you are African American, so that we do not lose the opportunity to make sure that the fight against COVID-19, we do not get left behind. And see, this, I'm talking out of my heart because of many people who have succumbed to this disease. You know, I know of a man who was an elderly man, African American man, and they had a family meeting, and somebody in the family had COVID-19 who supposedly did not tell them, and the man was dead in about 3 or 4 days after he had contracted COVID-19. African American man. So it is these stories that is driving our zeal and our concern, that do not allow the stories that you hear. I mean, first of all, for you as an individual in this country. And the second thing is that, particularly if you're African American, know that if they can give us the numbers, and the numbers are close to 10% or so, that is truly representative. And you should be able to avail yourself after careful discussion with your doctor or whosoever is taking care of you, so that our families do not suffer any longer from this COVID-19. We'll go for a short break and then we'll come back. Once again, we're talking about plaque buildup. This is very important. It starts at the age of 20. I want to tell you this. So if you are 30 years and listening to me, if you're 40 years and listening to me, there is a most likely probability that you already have the plaques in your blood vessels. And this program is here to help you to be able to deal with it and deal with it appropriately going forward. So invite somebody to join us here at this time, even as I will continue with this discussion. Once again, this is Healthy Heart. This is Dr. Isaac Opoku Asare.
Zoe Light Radio.
This is Zoe Light Radio.
Thank you again for joining us. So I want to talk about our topic for today is plaque buildup, and we're going to show you a picture here about the plaque buildup for you to see that, as I said, I have over the last 5 or 6 months, I've had the opportunity to take care of some very sick patients, and it's very sad. Why am I telling you this? Because somebody who looks very fit, extremely fit, if you see him, you think that he's in the best of shapes. We had the opportunity and the privilege to take care of the person because that person had 100% blockage of the blood vessels. And this person was less than 50 years. Somebody who was less than 30 years, he had several blockages in the blood vessels, and the person had to get stents. Not one, but more than one. And that individual is less than 30 years. Why are we seeing this? And this is troubling. You know, about 2 years ago, I know of a 24-year-old girl that was referred for open heart bypass because of a plaque buildup. The concept of bypass, it comes from the idea that the blood vessel is blocked and the surgeon is putting in a new blood vessel to bypass the blockage. That is the meaning of the word bypass. So if you don't have a blockage, then you wouldn't need a bypass. And this picture depicts why now we see this problem occurring all over. Arteriosclerosis, you see the picture over here. And we're going to leave this picture on the screen. Why is this picture very important? Because you see that the plaque buildup starts from the age of 20 years. And I very much believe that based on the lifestyles and what people are doing now sometimes without exercising and eating right, these plaque buildups may probably start in the teens. You know, some of these data actually came from military recruits. That's what is believed. But at the age of 20, the plaque buildup begins. And you realize that at the age of 30, if you look at this picture, you see there's building up and building up, so that by the age of 50, you have significant plaque buildup. And that is why traditionally we say that men beyond the age of 45 is when we see blockages in their heart. Not blockages in their heart. Let me rewind my. That's when we see them having heart attacks. It is not because when they get to 45 years, that is when they have the plaque. The plaque build up started at the age of 20. But by the time that they get to 50 years, they have more than 70% blockage of the blood vessels in their heart. And the blood vessels in other parts of the body. So, as I said, wherever there is an artery, in that particular artery, this process of plaque buildup can occur in that situation. And that is why, you see, the number is around 50, right? It's 5 less for men, so 45, and 5 for women, that is 55. And that is why this is important. And that is why when the patients ask me the question, Dr. Opoku, why did you think I had this heart attack? Dr. Opoku, why do you think I have this blockage? I always tell them this started 30 years ago. But the reason why you did not feel anything is that it started as 20%, 30%. And at that time, there was no word. There was no concern. You see, when it comes to why is this important? Because it affects many, many, many people. If you look at this picture, right? The picture of the world that we're showing to you, you're going to see the map of the world. There is no part of this world where people live that they don't have blockages in the blood vessels. And it's because of the fact that our lifestyle, the lifestyles that we talk about every time, right? And I'm taking this here, the lifestyle that we talk about, which is the 7 pillars of ideal cardiovascular health. What are they? We said that physical activity, less and less people with the COVID-19, I see people putting on weight like we've never seen before, right? Go and listen to our lecture on intermittent fasting, and that is going to help you, right? You can find us on YouTube. You can find us on Zoe Light Radio. Here is a place of good information. So the pillars of ideal cardiovascular health, which is what? Physical activity, or minimum of 150 minutes of leisure time or walking or physical activity. What other thing did we talk about? Appropriate dietary patterns, avoidance of what? Of polished or processed food in terms of white flour and all those processed meat that you need to stay away from, right? Reduction of salt, all those things are appropriate. And number 3, we talked about controlling what? Your calorie. and controlling your weight. These are very important things that you need to do. And the other things that we talked about is avoidance of smoking. I'm looking at this, the pillars of ideal cardiovascular. We'll never do this program without talking about it, right? And then you can add the other things that are also important in terms of ideal cardiovascular health. I believe that all that you need to do is this first three, right? Appropriate dietary patterns, physical activity, and what? And calorie control. If you can do these things and avoid smoking, these four, then the other three, which are the additional pillars of ideal cardiovascular health, which are controlling your blood sugar, making sure that your fasting blood sugar is less than 100 or hemoglobin A1C is less than 7, and also controlling your blood pressure. We'll talk about blood pressure next week. I mean, in the weeks to come. Really ask people to join us to listen to it, because it's going to really change your understanding of certain things. And it's important because people don't understand these concepts sometimes. But I believe that we're going to go into details and it's going to help you. Controlling your blood pressure. Normal blood pressure, I want to repeat this. A normal blood pressure is not 140/90. A normal blood pressure is 120/80. So if your blood pressure is 130/85, it's not controlled. Ideally, we expect, based on the sprint trial, to be that. And then finally, cholesterol, the monster in the room, right? That is the monster. Because this process, you see, if you don't do the first four things that we talked about, which is the dietary pattern, physical activities, and avoidance of smoking, and you end up getting the diabetes, hypertension, and the cholesterol. These three things, together with what you see over here, genetics. I tell people this. Pastors call it demons, doctors call it genetics. Whatever it is, deal with it, period. If you have a family member that got a heart attack, you have to know this, that your predisposition for getting heart attack or for you having a plaque buildup in your body is very high. And I tell people that sometimes people say, okay, I'm not big. As I told you, I saw a young person, very, very young person, somebody within his 40s. He looks like he's going to a gym. He had diabetes. His doctors told him to take care of the diabetes. He wouldn't listen to them, right? He had chest pain. He ended up having a massive heart attack. Ended up, we have to go into opening up the blockages in the heart, because he felt that because he looked tough, it's all right. But I always tell people, I would like to know that you are looking good inside rather than look good outside. And that is why sometimes certain people say, okay, I'm not big. Because I'm not big, I'm healthy. That is an error. I want to repeat that. Being big is only one of the problems. But in my life, I have seen more people that are thin who have blockages in their heart than people that are big. I don't know why, but that has been the experience. And in cardiology, I can back that with some data. There is something that we call the obesity paradox in cardiology. So it is not only the question of your weight, but if there is a genetic story, like your family member, specifically your mother, your brother, your father, and any of your siblings, if they ever had a blockage in their blood vessel, then that genetic predisposition is what really accounts for people having a plaque buildup in their lungs. Plaque buildup in their blood vessels, specifically the arteries. So it is important to look at these things. Not everything here is right. They put things like chlamydia and all those things. The data doesn't back it. But everywhere in the world, these pillars of ideal cardiovascular health are very, very important. And these plaque buildup is all over. So what is a plaque? What is a plaque made up of? So a lot of people think that the plaque is a clot. I want to make a distinction. The plaque is not a clot. The plaque is essentially made up of cholesterol, the bad cholesterol. And you're going to see this picture. We're going to leave this picture on for you. Two pictures. The good cholesterol and the bad cholesterol. And that is critical. I want to repeat this, at least in my life. Almost all the people that I've seen them having heart attack, almost all of them these days, I don't see a lot of elderly people having heart attack, interestingly. Now, most of the patients that I see having an heart attack are in their 40s and in their what? Early 50s. I was just having that discussion. Most of the people are like that. And they are men that I see. And my experience may not be that typical all around the nation, but we see this more and more. And what is happening is that, you see, the HDL, if you see this picture of the HDL is a good cholesterol. This is what you want. For a man, you want it to be more than 40. For a woman, you want it to be more than 50. If you are listening to me and you are here, you are more than 30 years, it is critical and important that you know what your good cholesterol is, because it helps you. Let us talk about the bad cholesterol. The bad cholesterol is the HDL. This is the monster. And I like this picture because it does evil. It does great evil. And you have to know that this level in your blood is what? Is reduced. This level in your blood of the bad cholesterol is reduced. Why? Because when this plaque build up, it doesn't build up only in the heart. It builds up everywhere. It builds up, the plaque can build up in the heart, blood vessels in the heart. It can build up in virtually any blood vessel in the body. So by addressing one single problem of plaque buildup, you can protect yourself from having a heart attack. You see the picture of this man holding his chest, right? He's holding his chest now and he's having a heart attack. And it is not coming from the fact that there is a problem that is started now. It is coming from the fact that there's a problem that started most likely 20, 30 years ago, and he may not have addressed it. And now the plaque has ruptured, and the rupture of the plaque is what is leading to what? Is leading to the heart attack. Listen to this. Every 40 seconds, an American, somebody in the United States, gets a heart attack. That is a number. And that is why, if you lead your life by just preventing plaque buildup, it can save you from having stroke. It's a blood buildup in the blood vessels in your neck that goes to what? That goes into the brain to give people what? Stroke. They have at least two forms of stroke. One of them, which is called the ischemic stroke, is just because of plaque buildup. This same plaque buildup can build up, or it can also occur in the blood vessel called the aorta. And when they break off, they go into the brain and can give people stroke. So by taking care of plaque buildup, you can take care of a heart attack. You can take care of what? Of stroke. And that is why if you are elderly, if you are feeling dizzy, or if you're having any evidence of stroke, it is important that you talk to your doctor and they check your cholesterol, they check the blood vessels in your neck, which is called the carotid, to make sure that there is no carotid buildup in that area. These are very, very important. The same process can occur in the stomach, especially for a man. Any man that has ever smoked above the age of 65, at least you need to see your doctor to make sure that there is an evaluation on you, to make sure that there is no there is no plaque buildup in the aorta. And interestingly, the aorta is the big blood vessels from which all the branches come off. Instead of making it narrow, the plaque buildup makes it balloon out. And when it balloons out, especially in smokers, when it balloons out, it can rupture. And when it ruptures, that is a disaster. That is a big, big, big problem. We'll talk about death in hours, not in days, when these things happen. So it is critical and important. Okay, as I said, wherever blood vessel blood goes to, a plaque buildup can occur. So look at the picture of somebody with very nice legs, right? But if you do not take care of this, right? If you do not take care of this, in the long run, you're going to see another picture. Look at this person. The other picture that you see here is not a picture that you want. But the reason why you see this leg like that is most likely that there was a blockage in the in the blood vessels in the legs, leading to the person's legs being black, and it's because of loss of blood supply to the legs. So just name it. from the brain to the foot. Everywhere blood vessels are, and there is no part of the body where there are no blood vessels. A plaque build up, which is a layer of cholesterol filled with what? Inflammatory products can build up in that place. You know, I was just talking to a doctor, and we're just having this discussion about blockages in people's legs. Let me tell you this. For African Americans, almost 50% of all African Americans above the age of 70 years have a blockage in their legs. But the reason why I'm sharing the discussion with you is that blockages in the legs, which is peripheral artery disease, which we will talk about in detail, is one of the most missed conditions. And there is a recent trial that came out, published in the European Cardiovascular Conference, called the THEMIS PAD trial. PAD means peripheral arterial disease. It shows that if you have a blockage in your heart and at the same time got a blockage, if you got a plaque buildup leading to a blockage in the blood vessels in the heart, and the same time you have got a blockage as a result of plaque buildup in your legs, you have 10 times the risk of losing your legs. This is a very, very serious issue. And you know why I'm saying that? In talking to the doctor, we're having this discussion, and I talked about the fact that, you know, because we're talking about people who have gone for bypass and other things. And I was saying that, look, I teach my residents that virtually, I can say confidently, that at least based on my experience, there is probably 80% of every patient that has gone for open heart bypass, virtually every patient that has gone for open heart bypass, those patients have got a blockage in their legs. I can tell you that. But most people will go around never checking that. I don't want to digress, but I would like you to join me, and that is one of my areas where we deal with in terms of blockages in the legs. And sometimes when it gets to certain stage, it is a very, very, very difficult situation. Reversing it is very difficult. And it is important that any part of your body that you can reduce plaque buildup, this is an opportunity for you to be able to do it, and that is going to help you. Because there is a saying that an ounce of prevention is better than a pound of cure. And that's what we're talking about. So you're going to see this picture. There is a picture over here, and we're going to zoom. I'm going to ask my my producer to highlight. It's a picture of 4 things that you see over here. 4 pictures. This is a picture from New England Journal. We want to give the credit to them. This is an article that came just about 2 or 3 weeks ago, and this is very extremely insightful. So we're going to look at, I'm going to ask him to put it on. You don't need to look at my nice face. Just look at this picture, because it's going to help you a lot. Why is that important? This picture, it tells you why cholesterol is a very, very important thing. So you see this blood vessel. In this blood vessel, you see the yellow thing over there. The yellow thing is all the bad cholesterol. So if you don't control your diabetes, if you don't control your blood pressure, right, these cholesterol, they get into the blood vessel. So what people don't understand is that the cholesterol does not sit on the blood vessel. They don't sit in the lumen. No. They get inside the blood vessel and they accumulate. So you see here that that's what we call the lipid core. Lipid is fat, more or less. So that the fat accumulates over here in this situation. And then they continues to invite more and more. So that it's like one fat gets in there and then it opens the door. You see? To allow more fat to come in. And that is why you should not allow the fat to go in. And this is what people don't understand. That it's not just the level of the cholesterol that you have, but the period of time that you've had with your cholesterol high. Because that period of time means that there is a high probability of more cholesterol, not just in your blood vessels. It's not the cholesterol in your blood vessels that causes harm. No. It's the cholesterol that is in what? that ends up going into the blood vessels to build a plaque. It's all about plaque buildup. But if you don't do this discussion, you will not understand that it's all about plaque buildup. And the cholesterol goes in there. Once it gets in here, then it invites, is oxidized. Then it invites inflammatory agents to get in there. So this is how the process starts. So a lot of people said, okay, we've heard stories of people. Let us come to B. And this is why people get heart attack. Okay. So you hear people that they saw their cardiologist. They saw their doctor. And when they saw their doctor, the doctor said, oh, we did a stress test in you. And the stress test did not show any blockages in you. Okay. Listen to this. Pay attention. I want my producer to put this on rather than me. You're going to hear my voice from the background. But listen to this. See, initially, you may have had 40% or 50%. So when you have 40 or 50% blockage, when you walk, there is no problem. Because you, with 40% plaque buildup, the lumen that is open can supply blood to you. But this is the danger. This is the danger. Whenever you have the plaque in there, the plaque over there, the plaque can rupture. So you did a stress test. The doctor told you that everything is okay, yet your cholesterol is high. And because you got that information, you think everything is all right. This has been a big problem in cardiology. Oh, he had a stress test. The stress test said he was okay. How come he got a heart attack? This is the issue. This false hope that sometimes you get from what? From these tests, instead of still paying attention to the cholesterol and other things, people don't do them. And that leads to a problem. This is the reason. You may have had a 40%, but the plaque will rupture. And when the plaque ruptures, it comes into contact with blood. And the blood contains something we call platelets. And the platelets, when they come into contact with the contents of the plaque, they form a clot. And that clot will then close up the remaining part of the blood vessel. When it occurs in the brain, that causes stroke. When it occurs in the heart, that causes heart attack. When it occurs in the abdomen, that can cause it to rupture. When it occurs in the legs, that can cause the legs what? To be lost. This is the issue. And why am I paying? Why am I showing this picture? Because you need to understand, listen, that because of the cholesterol over there, that is why you need to take your cholesterol medicines to lower it. Whether your stress test is normal or not, it doesn't matter. You need to go to control it. The second thing is that if your doctor has already told you that, or you've ever had a heart attack, or doctor has already told you that there's a plaque buildup, that is where the need for aspirin is important, because aspirin is a platelet. So why is it a blood thinner? It is thinner because it prevents the platelets from coming together. If you do not have a plaque buildup in your body, the data shows that aspirin may not be that helpful, even if you have got diabetes. So that is what we call primary prevention. But if you've got a plaque buildup, or you've got high cholesterol, and your doctor has told you one way or the other that there is evidence of plaque buildup, then that is why you need to take your cholesterol. You need to take your aspirin in this situation. Because, right, it is there to prevent you from what? From going into the situation where if you end up with a plaque that is over there, it is only 40%. But once it ruptures, right, if these agents are there, they help you. Why am I saying this? Let me tell you this story. This is the story, and this article made me understand that this concept of rupture and closure occurs in most people in the world. Just that the balance between rupture and healing, if it is skewed in one way, you end up with heart attack. But if the healing process is stronger than the rupture process, it keeps you safe. And that is what you're going to see in C and D. This is an excellent article from New England Journal. So let me give you this story, and then we're going to probably stop here, and next week we'll continue with this discussion on plaque buildup. so that you understand. Let me tell a story of a young man. He's a 49-year-old guy. He went to drop the daughter at a party. And when he dropped the daughter at the party, he had chest pain. And his father had chest pain at the age of 48, and his father died in front of him. So when he had a chest pain, immediately he realized that he was having a heart attack. But let me tell you the story. This guy had been on cholesterol medication, and he went to see his doctor. And when he went to see his doctor, they had a discussion because he was trying to push the doctor to stop the cholesterol medication. So the doctor said that, okay, it looks like your cholesterol is okay, so we can stop or we can cut back the cholesterol medication. So they did cut back. He cut back the cholesterol medication. Within a month, the guy had a massive heart attack. I'm talking about he had 100% occlusion of the blood vessel called the circumflex, and he had a 90% occlusion of the other blood vessel. The 90% occlusion did not happen one day. That started when he was 20 years old, based from the genetics and his lifestyle, And this guy was actually going to a gym, but the genetics and the fact that he stopped the cholesterol medication may have played a role. Why am I telling you this? One of the things that the cholesterol medication does, which we don't get from dieting, we don't get from anything, is that the cholesterol medication, it stabilizes the plaque. First of all, it shrinks the buildup of the plaque. And the second thing is that it makes it difficult for the plaque to rupture. And if the plaque is finding difficulty in rupturing, then it will become difficult for you to get heart attack. So the fact that your cholesterol is controlled does not mean that you need to stop the cholesterol medication, because it is not a question of just the plaque, but more importantly, to make sure that you don't rupture. The rupture of the plaque is what causes the heart attack. And that is why we want to do everything to help you not to go through that. So this sort of brings us to the understanding why we have plaque rupture over here. I don't want to keep on going on. We're going to stop over here. But the principle that we've established today is that plaque buildup occurs in every blood vessel, and it is made up of essentially cholesterol in the middle, and it invites inflammatory agents to it. And that is why it is important for you to take the cholesterol, because it is not only preventing heart attacks, but it prevents strokes, it prevents heart attacks, it prevents triple arterial aneurysms, it prevents worsening of a blockage in the blood vessels. The other thing is that even though your cholesterol is controlled, it is important for you to continue, because the rationale for heart attacks, rationale for most of these are bad outcomes that we're talking about, comes from a rupture of the buildup, and the cholesterol medication will keep it in that state. It is important for you to continue with the aspirin here, because taking the aspirin is going to help you so that the platelets are kept. The platelets are the things that form a clot on top of the plaque. A clot is different from the plaque. So when you rupture, you form a clot on top. So you have two bad things occurring together. And the aspirin or your Plavix or your clopidogrel or your ticagrelor that your doctor gives to you, it is important to help you. Thank you very much for listening to me. I hope that this discussion about plaque buildup has enabled you to understand these principles very well. And, it is said that if you can use one stone to kill two birds, that is a great thing. I tell you, if you will pay attention to reduction of plaque buildup in your body, you will take one stone to kill in most conditions, at least 3 major ones, which is stroke, which is heart attack, or blockages in the blood vessels, which is abdominal aneurysm, which is blockages in the legs, and many, many other good things. I would like you to join me next week, once again, on Saturday, 6 p.m., and on Tuesday, 6 p.m., and you can also watch these things on Zoe Light radio, as well as you can also watch these things on Zoe Light Radio website. You can also watch us on YouTube. You can send this to your friend and to other people who you know that they need to listen to this, because this process starts at the age of 20. So anybody that is above the age of 20 will be helped by this. We want to hear your comments about what we are doing, because that helps us to be able to continue with this. And we also want to know that if you have a church organization, or if you have any organization that is interested in hearing about these things in detail, we'll be able to also come to you in the form of a webinar or in the form of in-person program, once we can ensure that we can put in the appropriate safety measures to ensure that we can reduce any the slightest element of transmission of COVID-19. Thank you very much. And once again, this has been Dr. Isaac Opoku Asare and my awesome producer, Mr. Blay. We'll meet you again and continue with the discussion. Arteriosclerosis is a big term. We are fighting against plaque buildup. We're taking one stone to kill 4 birds. Thank you very much. God bless you, and God bless America.